Hi, this video forms part of the Diet and Nutrition subunit of the ONCALL Train the Trainer course for lay family health advisors. In this video we are going to talk about health and what affects our health. Let's begin by looking at health. The World Health Organization, or WHO, defines health as a state of complete physical, mental and social well-being, and not merely the absence of disease or infirmity. This is consistent with the biopsychosocial model of health, which considers physiological and psychological and social factors in health and illnesses and interactions between these factors. It differs from the traditional medical model, which defines health as the absence of illness or disease and emphasizes the role of clinical diagnosis and intervention. The WHO definition links health explicitly with well-being and conceptualizes health as a human right requiring physical and social resources to achieve and maintain. Well-being refers to a positive rather than neutral state, framing health as a positive aspiration. This definition was adapted by the 1986 Ottawa Charter, which describes health as a resource for everyday life, not the object of living. From this perspective, health is a means to living well, which highlights the link between health and participation in society. Health promotion and disease prevention programs focus on keeping people healthy. Health promotion programs aim to engage and empower individuals and communities to choose healthy behaviours and make changes that reduce the risk of developing chronic diseases and other morbidities. Defined by the World Health Organization, health promotion is the process of enabling people to increase control over and to improve their health. It moves beyond a focus on individual behaviour towards a wide range of social and environmental interventions. Disease prevention differs from health promotion because it focuses on specific efforts aimed at reducing the development and severity of chronic diseases and other morbidities. Wellness is related to health promotion and disease prevention. Wellness is described as the attitudes and active decisions made by an individual that contributes to positive health behaviours and outcomes. Health promotion and disease prevention programs often address social determinants of health, which influence modifiable risk behaviours. So what do we mean by social determinants of health? Health starts in our homes, schools, workplaces, neighbourhoods and communities. We know that taking care of ourselves by eating well and staying active, not smoking, getting the recommended immunisations and screening tests and seeing a doctor when we are sick all influence our health. But our health is also determined in part by access to social and economic opportunities, the resources and supports available in our home, neighbourhoods and communities, the quality of our schooling, the safety of our workplaces, the cleanliness of our water, food and air, and the nature of our social interactions and relationships. The conditions in which we live explain in part why some people are healthier than others and why many people more generally are not as healthy as they could be. Social determinants of health and conditions in the environments in which people are born, live, learn, work, play, worship, and age that affects a wide range of health, functioning, and quality of life outcomes and risks. Conditions, for example social, economic and physical, in these various environments and settings, school, church, workplace and neighbourhoods, have been referred to as place. Resources that enhance quality of life can have significant influence on population health outcomes. Examples of these resources include safe and affordable housing, access to education, public safety, availability of healthy foods, local emergency health services, and environments free of life-threatening toxins. Understanding the relationship between how population groups experience place and the impact of place on health is fundamental to the social determinants of health, including both social and physical determinants. Examples of social determinants include availability of resources to meet daily needs, for example, safe housing and local food markets, access to educational, economic and job opportunities, access to healthcare services, quality of education and job training, availability of community-based resources in support of community living and opportunities for recreational and leisure time activities, transportation options, public safety, social support, social norms and attitudes, for example discrimination, racism and distrust of government, exposure to crime, violence and social disorder, socio-economic conditions, residential segregation, language literacy, access to mass media and emerging technologies, for example cell phones and internet, culture. Examples of physical determinants include natural environments such as green space, built environments such as buildings, work sites, schools and recreational settings, housing and community design, exposure to toxic substances and other physical hazards, physical barriers, especially for people with disabilities, and aesthetic elements, for example, good lighting, trees, and benches. There is ample evidence that social factors, including education, employment status, income level, gender, and ethnicity, have a marked influence on how healthy a person is. In all countries, whether low, middle, or high income, there are wide disparities in the health status of different social groups. The lower an individual's socio-economic position, the higher risk of poor health. Health inequities are systematic differences in the health status of different population groups. These inequities have significant social and economic costs to both individuals and societies. Economic, environmental, and social inequalities can determine people's risk of getting ill, their ability to prevent sickness, or their access to effective treatments. These health factors have been explored by researchers using several models, but the most widely used is the Dahlgren-Whitehead rainbow model. This shows personal characteristics occupy the core of the model and include sex, age, ethnic group, and hereditary factors. Individual lifestyle factors include behaviours such as smoking, alcohol use, and physical activity. Social and community networks include family and wider social circles. Living and working conditions include access and opportunities in relation to home, housing, jobs, education and welfare services, and general socio-economic, cultural and environmental conditions include factors such as disposable income, taxation, and availability of work. Behavioural risk factors are the leading cause and occurrence of the morbidity and mortality due to chronic health conditions and injuries in the world, and indeed within the whole European region. There is convincing evidence that healthy behaviours include smoking abstinences, weight management, blood pressure control, and regular exercise are associated with a longer lifespan and better quality of life. However, health promotion activities and mass public health campaigns in particular have often failed to have the desired effect in terms of reducing disease, incidence and burden, simply because the compliance with the message in the form of the intended behavioural change is harder to achieve than its precursors of raising awareness, providing knowledge and altering attitudes. By working to establish policies and strategies that positively influence social and economic conditions, and those that support changes in individual behaviour, we can improve health for large numbers of people in ways that can be sustained over time, improving the conditions in which we live, learn, work and play, and the quality of our relationships will create a healthier population, society and workforce. I hope you have found this video interesting. For more information on the ONCALL project and training programs, please visit the ONCALL website at www.oncall.eu.